Yes, indeed, it is December. Yes, the last month in the month of this 2020, in the year 2021. Thank you very much for joining us this morning on the platform, the pinnacle of all discussions, right here on Flow 94.9 FM. This is the flow of God's own state. Still part of our morning show, the one we call Morning Spice, the discussion segment. We take a critical look at issues. We dissect them for you so that you can make better decisions in the nearest future. Welcome to the platform, the pinnacle of all discussions, right here on Flow 94.9 FM. It's midweek and it's Wednesday. My name is Michael Oni. Now, this morning, what are we looking at? Today, being the 1st of December, is the World AIDS Day. You might be asking, you might be saying, well, what's my business with AIDS? What's my business with HIV? Do you know your status? But just before you say no, it is none of my business. But do you know that if you do not know your status, the status of your neighbor also matters because of the transmission of HIV/AIDS. But we're going to get to that this morning on the program, the pinnacle of all discussions on Flow 94.9 FM, just as we are going to have an idea of the situation report of the prevalence rate of HIV in Abia State, even as we look at the community infections and assistance provided for carriers of this virus. So welcome on board. It's going to be an extended conversation, but then let me play back a report filed by our correspondent right here in Flow FM as we celebrate World AIDS Day.
It has been 40 years since the first AIDS cases were reported, and the world have seen urgent need to end the inequalities that drives AIDS and other pandemics around the world, and to deliver on the shared commitment to end AIDS by 2030. Today, the world commemorates World AIDS Day to show support for people living with HIV and to remember those who have died from AIDS-related illness. The Executive Secretary and Project Manager, Abia State Agency for the Control of HIV and AIDS, APSACA, Dr. Obonna Okechukwu Ehemere, speaks on the theme of this year's celebration.
The theme is this year is end inequalities, end AIDS, and end pandemics. AIDS is one of the pandemics. You've seen COVID-19, you've seen yellow fever, you've seen malaria, you've seen all manner of pandemics, plague in those days. There are pandemics that came and claimed a lot of people that had no cure, no follow, nothing. But we're lucky this time that AIDS, HIV/AIDS, has a treatment. Let me not say cure, has a treatment whereby you can go from being sick to being virally suppressed and being as free as any person.
He decried the percentage control and decline from donor agencies, which is threatening epidemic control and the possibility of ending AIDS by 2030. In his submission, Abia State Commissioner for Health, Dr. Joe Osuji, disclosed state government's commitment to ending the spread of the disease.
We are everywhere in the field now. You know about USCDC and the Caritas. They are everywhere in the field, in the communities, testing and giving medication. You know, we are locked by about 7 states or thereabouts. So rivers, people can trickle from there. Akwa Ibom, just everywhere. We are now intervening and making sure that people are guided.
According to statistics, the prevalent rate of HIV and AIDS in Anambra State is 2.6%, Abia and Imo 2.1%, Rivers State 7.6%, and about 7% in Akwa Ibom State. Although there has been significant progress in AIDS management from 2000 to 2018 through massive response in HIV programming, but the unfortunate thing about Abia is that it is bounded with states that have high prevalent rate of AIDS, hence the need for concerted efforts aimed at its control and eradication. Patricia Mborogu, Flow FM News.
Well, thank you, Patricia, for bringing us up to speed on HIV prevalence rate in Abia State and why Abia is peculiar. Very soon, I will be bringing in my analyst and, of course, panelist on the program. But you should know that HIV is the human immunodeficiency virus, and, of course, the AIDS is the acquired immunodeficiency syndrome, and it has existed in Nigeria for over 30 years. 2 index cases were discovered in 1985, one of which was a young female sex worker aged 13 years from one of the West African countries. And by 1998, 4.5% of the country's population have been affected by this disease. These are some of the things you should know, even as we're going to break it down for you to know the prevalence rate. Where are we in Abia, and what is being done by the government to check the spread of HIV, and of course to check the spread of HIV and AIDS, and also to control the spread of HIV AIDS. We understand that it is controllable. You can control this, you can manage it. Let me use the word manage. Well, in response to this devastating effect on both the Nigeria's health and socio-economic status, the federal government set up the National Expert Advisory Committee on AIDS, and with the assistance of the World Health Organization, it established several HIV testing centers across the country. Also, states of the federation states of the federation established the Agency in Control of AIDS, the Agency for the Control of AIDS. Just as we have it here in Abia State, we have the Abia State Agency for the Control of AIDS, ABSACA. So we get to hear about that this morning and also have an idea of the prevalence rate in the state. We have joining us on the platform Mr. Iro Okeze. Okay, joining us this morning is Dr. Agulana Rita, Senior Registrar, Community Medicine Department, APSUS. That's the Abia State University Teaching Hospital. Glad to have you join us, Doctor. Good morning to you, Dr. Rita.
Yeah, good morning, sir.
Yes, you're welcome. Glad to have you join us on the platform on Flow FM. When you talk about HIV/AIDS, you know, it's not something people want to hear about, especially in this part of the country. So you see some people say, God forbid, it is not my portion. But what are the realities that we should know about this?
Okay, thank you. The reality is that HIV/AIDS is real. It's a pandemic. When I mean pandemic, I mean that it cuts across the whole nations of the world. It's a pandemic and it's very real. And a lot of people are with HIV, but because of fear, they don't want to come out to get tested. Right now, the National AIDS STI Control Program 2020 guidelines, they brought up a rule that says that 95% of those living with HIV ought to know their status. So right now, we are all going out there, going to the community to make sure that people get tested and know their status. Because if you know it on time, there is this saying that says prevention is better than cure. If you know it on time, it's easy for you to treat it. And we have treatment for it. Funny enough, it's free. The treatments are free. There are NGOs like Caritas that have come to Abia State that have brought drugs for us and help us to get it across easily to people. Then we also want 95% already that know their status. We want them to be on drugs because the drugs are available and they are very effective. Very, very effective.
Now, yes, I can hear you. I can hear you loud and clear. So much is being said about HIV, especially on the social media, and so many myths behind the HIV. And some persons are saying when you contract this virus, you should just forget about life. I don't know what you have to say about this.
No. There are a lot of people living with HIV that have been on drugs for over 10, 20 years and they are living their normal life. They are living their normal life. They are fulfilling their God-given assignment. So HIV is not the end of the world, like most people think. It's not the end of the world. I've seen couples who are, let's say one of them is HIV positive, and the other one who goes ahead and marries the negative one who goes ahead and marries the positive one, and there are drugs to replace the other one, and it won't even contract it. And right now, technology is so advanced that even your children, even if you're HIV positive, your children will not even come up with the disease. Your children will be safe. All you need to do is to attend antenatal promptly and be on your drugs. As long as your viral load is suppressed, your children will not even contact you.
All right. I want to ask about the level of sensitization that we have in Abia State. You know, the problem with HIV/AIDS carrier, the carrier of this virus, the problem they face in Nigeria as a nation is stigmatization, and this is because of the lack of information for the people, and it's quite unfortunate, anyways. And stigmatization even kills faster than the virus. What do you make of the level of sensitization in Nigeria, especially Abia State?
Okay, the level of sensation is actually not so, it's on the moderate level. That is why the Medical Women Association of Nigeria, we are using a day like this, World HIV Day. Today is World HIV Day, December 1st, to sensitize the public on AIDS, trying to tell you that you can come willingly and get tested. It's better you know your status. If you are positive, we can place you on drugs, and the drugs are free. We can place you on drugs, and the aim is to get your viral load suppressed. If your viral load is suppressed, you live a normal life. It doesn't stop anything. That's why we're using this medium to sensitize the public on a day like this.
Okay, HIV test, is it a thing of compulsion for the general public? And we've seen cases where people are being advised to, like you're doing right now, to know your status.
Yes.
Why is it compulsory to know your status? In a situation, you know, it is attached to this sexual immorality. That's the general belief, especially in this part of the country. They say, hey, when you live your life this way, you contract HIV/AIDS. You know.
Okay, well, the first thing is, it's not compulsory. It's not a compulsory thing to. We don't force people to go and get tested. We can only advise. We can only counsel you to get tested. That is one. Then two, yes, it is true that sexual transmission is one of the major ways to contract the disease. But there are other ways to actually contract HIV disease. I've actually seen a version in my practice that is sexually, that is an HIV positive.
Okay.
You can get it even from saloons. You can get it from cutting your nails. You can get it from saloons for any form of cut in your body. You can get it from blood transfusion. A blood that was not properly screened. You can get it from, I've seen somebody that got a baby that got it from a blood that was not properly screened. So as long any form of contact with fluid and a break in the skin can cause HIV. So there are other methods apart from sexual transmission that can cause HIV.
Definitely, there are benefits to testing.
Yes, there are benefits to testing. The first benefit is that you are sure of your status. There is nothing like being sure of your status. Yes, I am free. I have tested and I am negative. Thank God. You're sure of your status. Then the second benefit that even if you are positive, the good news is that you just started with treatment. And finally, the treatment is free. You just started and you live your normal life. You get married. You get your children. It doesn't affect you. As long as you're on your drugs and your viral load is suppressed. So there are a lot of benefits in getting tested early.
It's what you said this morning. It's so scary when you say people even contract it through sharing the clippers and in barbing salons. I don't know.
Clippers in barbing salon, nail cutters, those that cut nails. Yes, people can get. That's why it's good to. We advise barbers always burn your clippers. Always use chemicals that can kill this virus. Always burn your clippers before you use it on the next person. And if it's possible, I advise people, like my husband has his clipper. If you can afford a clipper, beautiful.
Okay.
If you can afford a clipper. So
if you can't afford a clipper, it should be.
You can,
okay.
Then you tell your barber, Oga, please sanitize this clipper before you use them on me. Burn this thing.
So
that
sanitizing means, because we need to be very specific on the method of sanitization, the type of sanitization done. sanitizing rather, the type
Yes.
done on that clipper. Now,
Yes,
in a
just
situation
burning the
where
clipper, passing the clipper through
where some
fire.
persons just rub a particular liquid on the clipper, I don't know if that is sanitizing. So maybe you should lecture us on that, doctor.
Okay. And you just burning the clipper, passing the clipper through fire will go a long way.
Okay.
A long way.
And the fire should burn like how many minutes? Or
2
seconds?
to 3 minutes is okay. 2 to 3 minutes. Just make sure it goes through high flame. It's beautiful. It's okay.
Okay, just before I let you go this morning, doctor, you spoke about HIV positive patients raising HIV negative children. I think you should let us into how that is possible. It means there is life. I mean, there is hope for an HIV patient to get married to a HIV negative groom or fiancé, and they have their children without HIV.
Yes, there is. Anything I tell my clients is be open. Let your partner know your status on time. Just be open. Right now, there are drugs that the negative partner can take just before they are planning to conceive.
Okay.
And from 1 or 2 weeks after they are done with having sex for that period. So life is easy right now. If you are ready to go through that small sacrifice, why not? You can marry the person. You can marry the person. I've seen a lot of serodiscordant patients and clients where one party is negative and the other party is positive. And they're living their lives beautifully well with wonderful children. It's very
Interesting.
positive. Yeah.
All right. It's then the issue of stigmatization. I don't know what are the dangers of stigmatizing HIV patients. I understand that when you go testing, if you contract, unfortunately, have the virus in your blood system, it is discreet. I mean, your result is discreet. It is not made public. But then, in a
It's
situation,
very,
it gets
very
leaked.
discreet.
It gets leaked rather.
Yeah.
The person gets to face stigmatization. I mean, there are dangers to this. Maybe you should help us itemize this, the dangers of stigmatizing HIV patients.
Okay, like you said, it's a discreet procedure. We don't leak out secrets. That's one of the oaths we swore as doctors. So it's highly confidential. And what we advise you, even as an HIV patient, to get one person at least, either a friend or a family that can help you go through the process, because like you said, it can be stigmatizing. You can, even the patient himself can cause this stigma to himself. That is why you need a family, a loved one to help you go through the process, to help you remind you to always take your drugs. It can be so stigmatizing that people can think suicide, they can have suicidal thoughts.
Oh.
They can think that it's the end of the world for them. They can think that what I'm telling the public this morning, that there is no need for that. You can live your normal life. You can live your normal life. Actually, there's no need for that.
All right.
There's no need to cause pain on yourself. There's no need for that.
Dr. Rita, I want to really appreciate you for joining us this morning on the platform. Thank you very much for your analysis. We appreciate you. Enjoy the rest of your day.
All right. You too.
It is still the platform, the pinnacle of all discussions, right here on Flow 94.9 FM. And this morning we are talking health. Of course, today is the World AIDS Day, and we're looking at some issues surrounding HIV prevalence in Nigeria, especially Abia State. And do you know that Abia is 6th on the prevalence rate in Nigeria? Looking at the number of states we have, 6th. That's something we will be talking about even as we bring in our reporter who is joining us virtually, of course, reporting for Michael Opera Auditorium, where there is an event concerning today's celebration. HIV, Nigeria made history sometimes through the statistics published late last year, with addition of about 400,000 people living with HIV on treatment. That's a good one anyways. But did you know that Nigeria, being the Africa's most populous country, currently has HIV prevalence rate of about 1.4%, indicating a 40% reduction from the country's official national HIV prevalence estimates for 2017. Anyways, joining me this morning and virtually is Spike. That's a Ifanyawa from Michael Okpara University, Michael Okpara Auditorium, rather, reporting where there is an event ongoing concerning today's celebration, World AIDS Day. Spike, good morning to you.
Good morning to you, Michael. How are you doing?
I'm doing fine.
Yeah, so currently I'm actually, just like you said, I'm actually at the Michael Okpara Auditorium, where there's about to be a walk for commemoration of the day. And I actually have someone right here with me. I'll let him introduce himself and his position. So good morning to you. Let's know who you are.
Good morning. My name is Chinedu Iro, M&E, Abia Saka. That's Monitoring and Evaluation Officer, Abia State Agency for the Control of HIV/AIDS.
All right, good morning to you. Now, first of all, today's World AIDS Day. Your organization is about to have a walk with some other organizations. First of all, let's talk about what has been done in terms of sensitization of the disease in Abia State.
Well, the agency was set up actually for this main reason, to control AIDS in Abia State. And today, being 1st of December, is a designated day every year since 1988, an international day dedicated to the raising awareness of the HIV/AIDS pandemic. On this day, we come out to commemorate with the rest of the world people who have been affected by the virus, because a lot of people have died from HIV. So we come out in solidarity to create more awareness and to reach out to the grassroots to let them know that the virus is real, it's still out there, and the prevention modality.
All right. A couple of weeks back, there was a figure that came out about the number of persons who have HIV. I'd love to get from you how is currently is the number high or low in the state?
Okay. Since 2010, we had about 7.3% in the state. And since the inception of the movement, we have been working hard to make sure we reduce the prevalence. In 2018, the NIE, which is the Nigerian Impacts and Indicator AIDS Survey, estimated there to be around 2.3% in the state, while the national prevalence was about 1.4. So you see, the state prevalence is somehow higher than the national prevalence. And we rank at number 6 in the top states that actually have this virus. What I'm trying to say in essence is that in 2018, at 2.1% of the population of Abians with HIV, with amounting to about 55,000 thereabouts. We have actually been treating people over the years. What we have currently on treatment is amounting to about 20,000 in treatment. So it goes to say that we're estimating about 35,000 people out there who probably do not know their status and having this virus. You know, one of the major concerns of this virus is the spread rates, the mode of transmission. So we keep on trying to create awareness, which basic awareness too is we try to encourage people to use the ABC model. A, we say abstain from sex. But in an issue where you cannot abstain, you can be faithful. That's B, being faithful to one partner who you already know this status. And then C will be the correct and consistent use of condoms. It's part of our awareness campaign to make sure that we reduce the spread of the virus. So there are also other modalities that we are working with, because there's something called the key population community. It's a community of people who are the high drivers of the pandemic. This community consists of people in closed spaces, men who have sex with men, female sex workers, people who inject drug, and transgender community. So these are the key drivers of this community.
Okay.
And for them, we also have a prevention modality, which is called PrEP, like pre-exposure prophylaxis. They get enrolled through their community, identified. We have a one-stop shop where they can actually be enrolled based on their risky lifestyle. They can be administered PrEP. Also for serodiscordant couples are couples that maybe one person is HIV positive and the other person is negative. In order to keep that balance, they can actually coexist, but one of them has to be on PrEP most times so that they won't contact the virus from the one who is having the virus. And the one who is having the virus would obviously be on ART, which would actually help to drop the viral load of the virus. And at the point where the viral load is actually dropped, there will be no transmission. With a very low viral load, there will be no transmission, even if they have unprotected sex. So we've actually been doing a lot to try to curb the prevalence in the States.
I know you're about to go for your walk because they're waiting for you at this point. So before I let you go, quickly, number one is, since the sanitization started in Abia State, what has been the result? Has there been higher number of testings among individuals in the state? And let's start off with that one.
Yes, there has been a whole lot of improvement. There has been a whole lot of results. Like I said, in 2010, the prevalence was about 7.3. And 2018, it's about 2.1. So that's a huge gap. We've actually been able to reduce the prevalence. Then also in that line, we've also done a whole lot of testing. At this point, we just can't do massive testing anymore because we are looking for a particular set of people. So what we do is what we call index testing and social network testing. So whoever has the virus that is identified, we try to identify their social network or their index, their partners, so that we get them to be tested and treated. Because once identified, they are being enrolled into treatment. Thank you very much.
Now, also, what are the challenges you face?
Most of the challenges we face is trying to identify these communities that I spoke about earlier on. Because of the stigmatization and the discrimination amongst these communities, they are rarely coming out. So we try as much as we are creating this awareness to also end the stigma and the discrimination that comes with it.
All right. Thank you very much, Chendu. Michael,
yes.
He's in a hurry to move along because they're about to start their work. Before I hand back over to you, I want to speak to two other persons here. They're actually youth, and I'd love to get their take on what they know about AIDS as it is. Now, I've got Esther, that's your name?
Esther, yes.
Esther. So, Esther, so far, what do you know about AIDS in terms of sensitization, HIV, AIDS? How much do you know about it?
Okay, the little I know AIDS is acquired immunodeficiency syndrome, and it's the advanced stage of HIV. You know, HIV has 3 stages: the acute stage and the chronic stage. Now, when it advances more than these 2 stages, it now proceeds to AIDS, and that AIDS is incurable, but it can also be well managed.
All right. Also, what's your name again? Victor. So far, you're out here and to help with sensitization. You're a youth. Do you think youth these days are being cautious in terms of getting this particular disease and passing it on to others?
Okay. Good morning, all. I think yes. Everyone it doesn't look face like you normally say you get. So AIDS is more like something you should all be cautious of. As a youth now, before you do anything, you have to be conscious of how you do. You understand? You don't need to have to involve yourself in this kind of virus. So you don't have to be conscious if you want to do anything. Just be conscious of yourself and your body.
All right. So let me go back to you. Where you come from, and your society, your friends, and all that. How often do you have discussions about HIV/AIDS? Does this ever come at all, even if it's as a joke?
Usually, the setback in AIDS discussion is stigmatization, because most people don't want to talk about it because they feel it's probably a disease left for those who are serious, and forget that it's not just for the people that lead to HIV/AIDS. I don't think it usually comes up as a discussion.
Okay.
Most people shun the topic.
Do you used to feel at this age and time that we still have a great number of persons who are scared of people who have HIV/AIDS?
Yes. Most times people believe that if you have AIDS, I come in contact with this person, it's not like that. Most times it's part of intercourse and them not that. So the tendency of someone like being scared of coming in contact with someone is still rampant in our modern age. Yes.
So one final question before I hand back to Michael. Both of you, are you willing to eat, shake hands, and talk with someone who has HIV/AIDS? Yeah, I'm going to start with you.
Sure.
You have no issues with that, right?
I don't have any issues with that. Hug, can peck, so it's true.
All right, Esther, you?
As long as I stay within the safety guidelines, it's no problem.
All right, guys, thank you very much. Okay, thank you very much. Michael, back to you. About to start right now, and I have to let them go so that they can join the walk and go on with the sensitization.
All right. Thank you very much, Ifanyawa, for speaking to us and, of course, joining the celebration right here in Abia State. We do appreciate you.
All right. Thank you very much.
You're welcome. So that's Ifanyawa. This morning's platform is more like a sensitization on what you should know about the World AIDS Day. Of course, been celebrated today. It is still the platform, the pinnacle of all discussions right here on Flow 94.9 FM, the flow of God's own state.
It has been 40 years since the first AIDS cases were reported, and the world have seen urgent need to end the inequalities that drives AIDS and other pandemics around the world, and to deliver on the shared commitment to end AIDS by 2030. Today, the world commemorates World AIDS Day to show support for people living with HIV and to remember those who have died from AIDS-related illness. The Executive Secretary and Project Manager, Abia State Agency for the Control of HIV and AIDS, APSACA, Dr. Obonna Okechukwu Ehemere, speaks on the theme of this year's celebration.
The theme is this year is end inequalities, end AIDS, and end pandemics. AIDS is one of the pandemics. You've seen COVID-19, you've seen yellow fever, you've seen malaria, you've seen all manner of pandemics, plague in those days. There are pandemics that came and claimed a lot of people that had no cure, no follow, nothing. But we're lucky this time that HIV/AIDS has a treatment. Let me not say cure, now has a treatment whereby you can go from being sick to being virally suppressed and being as free as any person.
He decried the percentage control and decline from donor agencies, which is threatening epidemic control and the possibility of ending AIDS by 2030. In his submission, Abia State Commissioner for Health, Dr. Joe Osuji, disclosed state government's commitment to ending the spread of the disease.
We are everywhere in the field now. You know about USCDC and the Caritas. They are everywhere in the fields, in the communities, testing and giving medication. We are locked by about 7 states or thereabouts. So rivers, people can trickle from there. Akwa Ibom, just everywhere. We are now intervening and making sure that people are guided.
According to statistics, the prevalent rate of HIV and AIDS in Anambra State is 2.6%, Abia and Imo 2.1%, River State 7.6%, and about 7% in Akwa Ibom State. Although there has been significant progress in AIDS management from 2000 to 2018 through massive response in HIV programming, but the unfortunate thing about Abia is that it is bounded with states that have high prevalent rate of AIDS, hence the need for concerted efforts aimed at its control and eradication. Patricia Mborogu, Flow FM News.
Anyways, just to let you know, before I throw the lines open, because I'm going to be asking you the question of what you know about AIDS. Do you still stigmatize? That's a big question. And do you know your status? Anyways, it is. I'm not expecting you to share your status live, but I'm asking you, do you know your status? And do you think you should know your status? These are some of the questions I'm asking this morning. It's a sensitization anyways. It is a sensitization about HIV and AIDS. Findings reviews that the national response to HIV/AIDS in Nigeria has recorded many successes, of which includes the provision of a national strategic framework to fast-track the response towards ending AIDS in Nigeria by 2030. I hope we're on track on that one. HIV/AIDS Anti-Discrimination Act was signed into law in 2014, which makes it illegal to discriminate in any form against people based on their HIV status. So if you're discriminating, just know that you're acting against the law. If you're stigmatizing someone, Just know that it is against the law because it has been signed into law, HIV/AIDS Anti-Discrimination Act 2014, and the formation of strategic partnership with key stakeholders, which has led to the placement of over 1 million persons on the antiretrovirals, which is very free. We have 6 regional offices to track and monitor the progress of HIV control programs across the country. You heard a couple of minutes ago when we spoke with the evaluation officer right here in Abia State, and he also highlighted some of the progresses, some of the successes achieved by the office, by the APSACA right here in Abia State. We have currently number 6 in Nigeria. I believe we can do more anyways. The lines are very much open. You can join in the conversation this morning. 0808 182 6949, 0811 605 2949. You can also drop your messages on 0906 510 8289. Hello, good morning to you.
Good morning, Michael.
You're welcome, Mr. Princewell.
Thank you so much.
You're
happy new
welcome.
month of December, and happy SD.
Thank you.
Thank you. I still remember Mr. Princewell Uswago from here, no more natural. The issue is this. My thanks goes to the APSAC and NACA in Abia State. Time was when APSAC came first on the people that made judicious use of the resources given to them for S program in Nigeria. I think my thanks goes to them on that. Despite the fact that on the prevalent level now they have come to 6. But that's not apart. I would like NACA and APSAC to ensure that they spread their tentacles to schools and other tertiary institutions. So as to tell students to have a necessary test status before they enter into any of the higher or lower institution in Abia State. It will make it not mandatory, but it is necessary because one ought to know his status. Then secondly, I would like them to spread their tentacles on the dissemination of information. Like Awa has said there, students were saying HIV is acquired immune deficiency syndrome is different from HIV. That one is just theoretical. The practical, they should go straight to tell them actually how this HIV can be contracted. Instead of teaching them theoretically, let them go straight. Without their state orientation agency, let them go straight to the interior, tell people about the need of them to know about HIV and AIDS. These are my team. God bless my brother.
Thank you very much for sharing your thoughts with us. Hello, good morning to you.
Morning, Michael.
Good morning to
my
you.
My name is Enoch.
You're welcome, Mr. Enoch.
Thank you. Somebody saying HIV is not abortion, is merely wallowing in illusion. If he does not take a cautionary measure, apart from sexual immorality, there are other means through which HIV/AIDS can be contracted, just as the doctor pointed out. If a non-carrier uses a sharp object with a carrier, it is likely to contract it. For instance, youth who abuse drugs normally use one syringe on several persons.
Syringe.
They don't even care whether there is HIV or not. There was a TV program I watched some time ago.
Yes.
When they were asked, they said that they don't that they are not aware of it or they don't even care. So such people can easily contract. After bathing, somebody should immediately wash his head with medicated soap, sponge, and the Dettol. That is what I do whenever I have my head.
All right. Thank you for sharing your thoughts with us. Just to go back to the survey conducted by the Nigeria HIV/AIDS agency, the NACA, National Agency for Control of AIDS, the NACA, and it was revealed there was this survey that we're actually basing this conversation on the recent survey, because if you check the list of the survey conducted by this, that the last one was conducted in 2018, and the national figure stood at 1.4%. Southeast prevalence rate was 1.9%, which is above the national average. I'm going to tell you something about this, but let's take this. Good morning to you.
Good morning this morning.
You're welcome.
I'm just a guy for it.
All right.
I think I'm glad that this issue have come up again because you look at it, the insecurity and the challenges running over the country. Since I have drove away the conscience of the people, not mindful of the caution of this deadly disease. I thank God that it has come up again. And I think this is not when issue of election and issue that has to do with party convention and all the rest. We see our representatives, they will now come down to educate or to lecture people. They start people on the issue of that. But this is another way. They have to come in. Let them now be at the forefront. You know, having a town hall. Not even in the time of election, they will now start having a town hall or maybe grouping people to go and start people or campaign. So this is another way. We use this medium to plead with our leaders. So many of them are coming to radio to talk. Discuss the issue of HIV and the AIDS is very, very dangerous in our system, and people are no longer mindful of it. So they have to come down again to make sure that a partner go to people who knows how to
for sensitization.
So yeah, to lecture people, to start people, so people will also know that this is also among us.
All right.
That's the best time to do it, not the time of election.
Thank you for sharing your thoughts with us. We do appreciate you. Hello, good morning to you. That didn't pull through. So I was telling you about this survey conducted by the Nigeria HIV/AIDS Indicator and Impact Survey. The report showed that Northwest has 0.6%, Northeast with 1.1%, Southwest with 1.2%, Southeast with 1.9%, North Central with 2.1%, and South topping the chart with 3.1%. Let's take this. I'll tell you the implication of that. Hello, good morning to you.
Hello, good morning, Michael.
You're welcome.
Yeah, I'm calling from Modimaya.
You're welcome.
All right. I think the major thing that we're supposed to be looking at now is supposed to be how to save our people from this kind of disease. You know, it's a thing, and it's very nice for us to know our status these days. So I think the way that we're getting it, I think is very nice and to remember these days. I think we're very happy about that, and we should be careful about all this so that we can continue on this.
All right. Thank you. Thank you for sharing your thoughts with us. So I'm talking about that report, the Northwest with 0.6%, Northeast with 1.1%, Southwest rather with 1.2%, and Southeast with 1.9%, North Central with 2.1%, and South with 3.1%. The implication is that South tops the chart with followed by North Central and Southeast with 1.9%. Well, Nigeria's national HIV prevalence is 1.4%, and it is among adults aged between 15 to 49. Women in this age bracket are more than twice likely to be living with HIV than the men, 1.9% versus 0.9%. So the difference in HIV prevalence between the women and the men is greatest among younger adults, with young women aged between 20 to 24 years more than three times as likely to be living with HIV as young men in the same age group. And among these, we've got children 0 to 14. HIV prevalence, according to the data, is just 0.2%. So the prevalence in the Southeast remained among the adults. That's here in the Southeast between the ages of 15 and 64, and mostly affected are the female in the age bracket. And it was gathered that 7 states, Akwa Ibom, Benue, Rivers, Taraba, Anambra, Enugu, and Abia are the most affected and have the high prevalence rate of 2.0% and above, accounting for 50% of the overall estimated number of persons living with HIV/AIDS in Nigeria. One of the reasons we're staying on this conversation because it borders us right here in Abia State. Akwa Ibom, Benue, Rivers, Taraba, Anambra, Enugu, and Abia having above 2.0% prevalence rate, which is above the average in Nigeria, accounting for 50% of the overall estimated number of people. So you have to Be very, 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 very careful. Know your status and be mindful of what you do. Very, very important. Let me just break down the figure for you. Akwa Ibom has 5.6% prevalence rate, meaning Akwa Ibom is leading in Nigeria with 200,000 burden. Benue State with 4.9%, about 188,482 burden. Taraba, followed by Rivers, 3.8%. That's about 196,000. Then Taraba with about 2.7, about 52,000 persons. Then Anambra with 2.4. Then Enugu and Abia on the 6th position. Enugu and Abia with 2.1%. Enugu with 66.768 burden, and Abia with 51,000 plus burden. So some insist that some of those figures have been bandied to attract unnecessary attention, given the reports on earlier timelines on the fight against the disease, which had not been made public. But then we should still be careful. Very, very important, even as we encourage donor agencies to continue supporting the fight against HIV/AIDS. And also, you should also get informed, participate in the conversation like this, so that you have an idea of what's happening. Get your own clipper for the guys that go to the barbing salon. And if you cannot, like you heard the doctor say there, you should insist on the clipper being sanitized, properly sanitized, using open fire, open flame, like she said. Anyways, that's how far we can go this morning. We do appreciate you, appreciate your contribution. We do appreciate you for joining in the conversation, and many thanks to the guys that made this a success. Ifanyawa, they're reporting from the Michael Opara Auditorium right here, where right there in Umua here, where the work is ongoing to sensitize people on today's celebration. And also Samson Eze, the producer of the program, and also Akin Lotontaye, also the producer of the program. Many thanks to you for joining this morning on the platform, the pinnacle of all discussions, and also the guys behind the visuals on our Facebook page, Stanley and Chinedu. Do enjoy the rest of your day. Stay safe. Know your status. Very important. My name is Michael Oni.